Hi, my name is Maria. I'm going to be your student nurse today. So today we're going to be performing a health assessment. It's going to consist of your thorax, lungs, cardiovascular system, and peripheral vascular system. Is that okay with you?
Mm-hmm.
Great. How are you doing today?
I'm doing good.
Great. Okay, so first we're going to start off by assessing your thorax and lungs. Ready to get started?
Mm-hmm.
Alrighty. So first we're going to be identifying some landmarks. So this is your suprasternal notch right here. And if we go down, this is your angle of Louis. And then if we look right here, your trachea, it's midline. And then if we move over here, this is your second rib, about right here. These are your clavicles. This would be your midclavicular line. And this would be your anterior axillary line, your mid-axillary line, and your posterior axillary line. And on the front, you have 5 lobes. So on the right side, you're going to have 3. You're going to have the right upper lobe, right middle lobe, and right lower lobe. And on the left, you're going to have your left upper lobe and left lower lobe. And on the back, you're going to have 4 lobes. So it's going to be your right upper lobe, right lower lobe, and on the left side, your left upper lobe and left lower lobe. These are your scapula, so this would be your scapular line. This is your vertebra, so this is going to be your vertebral line. Okay, so now that we have identified our landmarks, I'm going to be inspecting your chest cavity. So first we're going to start off. I see that your chest is symmetrical. I don't see any abnormalities in that. Your breathing is upright, so that's good. Now we're going to be looking at your angle of the ribs and symmetric expansion. So for this, I'm going to have you lift up your shirt, please. And I see that your ribs are at 90 degrees, and I'm going to be touching your chest, okay? My hands are a little full. Okay, can I have you breathe in and out? All right, and on the back, your ribs are at 45 degrees, and my hands are a little cold. I'm going to have you breathe in and out. Okay, so they're even on both sides, so that is good. Now I'm going to be looking at your skin color. I do not see any cyanosis or anything like that. Your facial expressions are appropriate for this scenario. Your level of consciousness is Orient times 4, so that's good. And your quality of breathing is unlabored, so that's really good. Okay, now I'm going to be palpating, percussing, and auscultating your lung sounds. So first we're going to start by performing a test called tactile thermitis. Okay. I'm going to be touching your chest, and you're going to say 99 every time I move my hands, okay? Go ahead.
99, 99, 99, 99, 99, 99.
All right. Vibrations are equal on both sides.
99, 99, 99, 99, 99, 99.
Okay, vibrations are equal on both sides as well. Okay, so now we're going to be percussing your front and your back. Okay, on your back. Okay, so on both sides, bilaterally, your sounds are resonant, so that's good. Okay, now we're going to be auscultating your lung sounds, and we're also going to be inspecting your voice sounds. Okay, so for this, I'm going to have you lift up your shirt, please. Okay, and I'm going to have you breathe in and out. Okay, one more time. One more time. And right here. And right here. All right, now on the back. Breathe in and out. One more time. One more time. And another time. One more. And again. Okay, sounds are equally bilateral. You can say it like that. So now we're going to check your voice sounds. So I'm going to have you say 99.
99. 99, 99, 99, 99, 99,
Okay, now on the front side.
99, 99, 99, 99,
Okay, now I'm gonna have you say E.
E, 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 E,
Okay, now on the back. Go ahead.
E, 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 E.
Okay. So your sounds on both sides are muffled, which is good and indicates nothing wrong is wrong with you. Sounds are equal bilaterally, so they're even, so that's good. Okay, so now your thorax and lung assessment is complete. So now we're going to move on to your cardiovascular system. So for this, I'm going to have you lay down, please. Okay, so I'm going to be inspecting jugular and venous distension and pulsations. So for this, I'm going to have you turn your head all the way to the side. Oh, sorry. Okay. Okay, I don't see any excessive pulsation, but I see a pulse. Okay, next. Okay, that's good too. Now I'm going to check for any abnormal cardiac movement. Okay, so I'm going to lift up your shirt. Okay, I don't see any abnormal chest configuration, so that's good. Or any visible cardiac movement, so that's also good. So now I'm going to be palpating your carotid arteries. So I'm going to have you turn your head just to the side just a little bit. Okay, now on the other side. Okay, so carotid pulses are equal on both sides, so that's good. Now I'm going to be checking your apical pulse. So I'm going to have you lift up your shirt again. My hands are a little cold. Okay. So now I'm going to be auscultating your heart sounds. Okay. So for this, I'm going to have you lift up your shirt one more time. Okay. I'm going to be checking your okay. And last one, okay? Okay, so I didn't hear any abnormal heart sounds, no murmurs, no anything like that, so that's good. Okay, and your apical pulse or your pulse was 74. So now I'm going to be checking your carotid. So for this, I'm going to, when I auscultate your carotid, I'm going to have you hold your breath, okay? Can you hold your breath for me? Okay, on the other side. Okay, I did not hear any brewery, so that's good. Your rate was 74, your rhythm was regular, so that's good. Your S1 sounds are louder at the base, and your S2 sounds are louder down at the apex. I didn't hear any presence of heart murmurs or anything. Okay, so that concludes your cardiovascular assessment. Now we're going to move on to your peripheral vascular assessment. So for this, you can keep staying laying down. So first we're going to be identifying skin trigger. So I'm going to be pinching your skin just a little bit. Okay, you have immediate recoil. I don't see any tinting. For temperature, okay, it's warm and evenly distributed throughout, so that's good. I'm going to be checking for edema. Okay, I don't see any edema. Okay, so now we're going to be checking for capillary refill. So can I see your hands? Okay, so because you have acrylic nails, I'm going to be testing this a different way. Okay. Okay, your other hand, please. Okay, so cap refill on your hands is less than 3 seconds. That's good. Okay, cap refill on your feet is good too, less than 3 seconds. Now we're going to be checking for calf pain and tenderness, so I'm going to have you bend your knees just a little bit. Okay, so is there any tenderness in your calves? Nope. Okay, now we're going to be checking for calf circumference. So I'm going to be measuring your calves. Okay. So 14 on the right. And 13 and a half on the left. 13 and a half on the left. Okay, so that's good. Okay, so now I'm gonna be palpating your pulses. Okay. So this is radial. Okay, even on both sides. And brachial. Okay. Now your pedal pulse and your posterior tibial. And if you bend your knees for me, you're going to be doing popliteal. Okay. And if you can sit up for me. And these are going to be our last two tests. So now we're going to be checking for your epitracheal nodes. So if you want to shake my hand. Okay, nodes are not palpable in that arm. Okay, I don't feel any nodes on that arm either. So now we're going to be performing your Allen's test. So I'm gonna hold your hand. Okay, so I'm going to be pressing down, and I want you to open and close your hand like 5 or 6 times. Okay, now we're going to let go. Okay, we get immediate blood flow. Now I'm going to have you do the same thing on this hand. Okay. Okay, immediate blood flow in that arm. Okay, so this concludes your peripheral vascular system and your overall assessment. Thank you so much for participating.
Thank you.
Thank you. Close the curtain.